Hi, everyone, and welcome. Thanks for joining us today. We're just going to give it a minute until the top of the hour, and then we'll get started. Okay, welcome again. Thanks for joining us. It is the top of the hour, so we'll go ahead and get started. Today, we're talking about addressing aggressive driving through two different kinds of strategies, engaging bystanders and developing effective messages. I'm really glad that you're here with us today. We appreciate your interest in this work, and I'm excited to share the background and then some resources with everyone today. My name is Dr. Bridget Hanson. I'm a principal research scholar at the Center for Health and Safety Culture at Montana State University. We use this WebEx system, which you're now a part of for this webinar. If it's your first time, we just wanted to give a few tips here. If your audio isn't quite working, maybe you're seeing closed captions or something, you can go ahead and change the type of audio connection you have at the bottom where it says connect audio or next to your speaker icon. Maybe you should be able to connect by phone if you want, or the computer, whichever is more easy for you. And then we'll be using the chat today for questions. And so if you go to the chat box, the little speaker bubble in the corner, you'll be able to put any questions there. Feel free to add those at any time. My colleague Kelly Green, who's on the webinar with us today, will be monitoring that for questions about the project and the work, as well as questions about technology or any challenges that you have there. Just a little bit of background about the Center for Health and Safety Culture. If you're not familiar with us, we are an interdisciplinary center serving communities and organizations. We do applied research and evaluation, as well as training, guidance, technical support, and we're really focused on cultivating healthy and safe cultures. We work in a variety of topic areas. Our core issues are traffic safety, substance misuse, domestic violence, and child well-being. And across those, we try to promote healthy and safe cultures. What we're talking about today is work that's funded and supported by the Transportation Pooled Fund on traffic safety culture. And we are grateful to the states that participate in the pooled fund and support our work. Before I get into the details of this work, I also wanted just to acknowledge our team. We have a large team on this project, folks that contributed in different ways across the different components of the project and bringing everything together. So my colleagues, including some graduate students who assisted us, are listed on this slide, and I am grateful for each of their contributions. So the reason that we're all here today, we know that traffic safety is an important issue in our communities and states, and traffic crashes are a major public health concern, with about 40,000 people dying in crashes each year. We also know that aggressive driving is prevalent, and people are pretty concerned about aggressive driving as a risky driving behavior. In previous work that the center did, also as part of the Transportation Pooled Fund on traffic safety culture, we focused on understanding aggressive driving, and part of that work was defining it. And so we updated the AAA's previous definition of aggressive driving to define aggressive driving as any unsafe driving behavior that's performed deliberately with ill intention or disregard for safety and impacts others. So having a definition and a shared understanding of what aggressive driving is helps us to move towards better work to address aggressive driving. Also, as part of that previous work about aggressive driving, in addition to that shared definition, which came from a literature review of aggressive driving work that had been done previously, we also conducted a pretty large survey of drivers in the US who engage in aggressive behaviors. That survey gave us a number of insights about potential ways to address aggressive driving. And you'll see there's a link there to the project page on the Montana Department of Transportation website, and a short bit.ly link, and Kelly also put that in the chat for us conveniently. So on that page, you'll find the report and the resource from our previous phase of this work that you may have seen previously, but if not, we had 4 primary recommendations that came again from the insights from the survey of drivers who engage in aggressive behaviors. And those insights were to grow pro-social driving, because folks who engage in pro-social driving are less likely to engage in aggressive driving. And also to use strategies that support cognitive reappraisal and adaptive responses for drivers, because we know that's part of the cycle of aggressive driving. And by thinking about the situation differently or having a different kind of response in a situation can break the pattern before aggressive driving might even occur. And then we also, the 4th icon that you see there, recommended increasing perceived disapproval through bystander engagement, because folks who thought that important others in their life disapproved of them driving aggressively were less likely to do so. So again, coming out of our previous work, we had these recommendations that were based on the data that we collected then, but we wanted to better understand what this could look like in application and what kinds of strategies might support those recommendations. So there were 2 purposes of this project. To sort of think about this as a follow-up project to that previous work that we had done on aggressive driving. And the first purpose was to really develop and test strategies to engage bystanders, right? Because we had said increase perceived disapproval through bystander engagement, but we didn't have a lot of detail about good or evidence-based or data-supported ways to engage bystanders. So one of the purposes here was to gather more information about what that might look like. And then the second purpose was to develop and test media messages to reduce aggressive driving. We know that a lot of states and other partners put out a lot of messaging about driving, including aggressive driving, and with the ideas about promoting pro-social driving and increasing cognitive reappraisal and adaptive responses, media messages are one accessible way to do that. And we wanted to test some media messages with drivers in order to, again, further refine those suggestions for implementation. And so we're going to talk about the first part first, and then we'll move to the second part. So the first part is about engaging bystanders. So the goal here was to develop and test that intervention. And we went through an approach that included key informant interviews, developing an intervention and testing it, and then creating resources based on that. And I'm sort of going to give you the end at the beginning. And so one of the resources that we developed, there's a link here to a conversation guide for friends and family. So again, these bystanders, to engage bystanders when they're concerned about someone's aggressive driving. So you can use that bit.ly link or the link that'll come in the chat to access the conversation guide and take a look at that. And as we talk today, I'll walk through how we came to that as the resource. And then there's also a toolkit to support the dissemination of the conversation guide. And so the conversation guide, the idea is to get it in the hands of the bystanders. And then this toolkit supports you and other partners in disseminating that conversation guide. And so there's a link also to the conversation guide toolkit that again supports dissemination. And so as I was saying, we started with these bystander interviews. We wanted to understand what it was like for folks who had a close friend or family member who drives aggressively. We wanted to hear from them about their experiences and use that information to develop a supportive resource or intervention to help them engage with their person more effectively. And so we wanted to hear again from them about their experience. So we recruited via social media bystanders. We used advertisements like this on social media and sent folks to a screening survey where they completed more information about themselves and their person who was driving aggressively. So that screening survey assessed the frequency of risky driving behaviors of the person that they were concerned about. And in this survey, we asked them about both aggressive behaviors and non-aggressive behaviors. You might have noted that we didn't advertise as people who drive aggressively, right? Because that phrase means different things for different people. And sometimes when people think about aggressive driving, they only think about road rage and sort of more extreme versions of aggressive driving. And we know that aggressive driving is a continuum of behaviors. And so anyone who was concerned about their loved one's driving behavior might see themselves in that advertisement. And then we use the screening survey to identify if they met inclusion criteria. And so if they were engaging in aggressive driving behaviors in the last 30 days, then they met inclusion criteria. If they didn't also engage in, or if they weren't also concerned about the person because of old age or other kinds of disqualifying concerning driving behaviors. In the short screening survey, we also asked about the relationship and their demographics. And then we invited folks to participate in interviews. We conducted 16 interviews with bystanders. And so again, these are people who said that there was someone in their life whose driving concerned them. And these bystanders were 6 men and 10 women of different ages. You can see the ages and the geographic breakdown there. We had 7 people who were friends, 4 parent-child, and 5 partners or spouses. And in these 16 interviews, folks talked about the drivers whose driving concerned them, right? And the drivers were also split by gender, 8 men and 8 women, diverse ages, and we asked if they had children, and 6 of the 16 reported that they did. The people who were driving aggressively, most commonly, the bystanders reported that they were speeding in traffic, responding to others with gesturing or cursing, and weaving in and out of traffic. There were no differences based on relationship group in the kinds of aggressive driving behaviors they were engaging in the 30 days before the interviews. And then we were asking the bystanders about their experience. So we asked them why they thought the person in their life was driving aggressively. And the bystanders talked about the people being overconfident in their driving abilities, being impatient, this idea that the person was such a good driver, it was okay for them to bend or break the rules, and because they were looking for that kind of adrenaline rush. And this parallels what we see in the literature about factors associated with aggressive driving. We also asked the bystanders why they were concerned about their person's aggressive driving. Again, all of these folks were recruited because they were concerned about the driving of someone important in their life. And we said, why are you concerned about their driving? For friends, they talked about the safety of their friend, of the driver. They also talked about their own safety as a passenger, right? These friend duos, the bystander was often a passenger in the vehicle, and they talked about being a little bit concerned about their own safety as well. Friends also talked about how it's not the right thing to do, and you'll see a quote there that represents that. Like it's not moral, it's not appropriate. And they also talked about other consequences that were different than safety, mostly things like getting a ticket, losing their license, or having financial consequences. Spouses and partners talked about a number of the same things. They again talked about driver safety, they talked about other consequences, and they also talked about the safety of other road users. They're just worried about the safety of everybody involved, as well as these other consequences that could come from aggressive driving. Parents were similar, right? They were concerned about the safety of their child as well as the safety of other road users and these other consequences. So a lot of commonalities about why folks were concerned. And you can probably, this might make sense to you, right? Like we weren't surprised by why folks were concerned. In the interviews, we asked if they'd ever tried talking to the person about their aggressive driving, and almost everyone had. Friends said that they would make a joke, they try to get the person to laugh, but that sometimes that didn't work or wasn't very effective because then the driver thought it wasn't that serious. They just sort of brushed it off. Friends also pointed it out, often in the moment, but also sometimes after driving. They just would make an observation. Friends talked about not being judgmental about it and how that was important. Similarly, they also talked about hinting at it during driving without being fully explicit about it, but just saying something like, oh, watch that person, we almost hit him. And friends talked about trying often, trying several times to talk to the person who's driving concerned them. Similarly, spouses talked about frequent attempts at talking to their spouse or partner about aggressive driving, both in the moment and after, and that was similar across groups. Spouses and partners also talked about sort of talking about it preemptively, right? Like before we get in the car, just talking about, could you please not do that this time? It'll make me feel better. Spouses and partners talked about, getting mad and yelling, sort of having more emotional responses sometimes than friends. And a few of them also talked about trying to be soothing and calming, understanding that their spouse or partner who was driving was kind of worked up in the moment, perhaps kind of angry, and they tried to be sort of a calming presence. Parents said that they tried to talk to their child about their aggressive driving as well, saying things like, we don't yell at people. They say it in the moment and then discuss it more fully later. One in particular said that she has to take a calm approach and, quote, not like motherly because the teenager, young adult child did not respond well to being sort of mothered in that way. So trying to take a calm approach and just point it out. But again, parents talked about getting brushed off a lot and not really feeling heard. We asked if they tried anything else, right? Besides talking to the person, what else have you maybe tried, if anything? And friends talked about trying to bring other people on board, enlisting other people, like a girlfriend or a significant other or their friend's mom to be the one to talk to them. They also talked about offering to drive. One in particular said so that the other person could learn from them. And they talked about giving a little bit of a pep talk before driving to help the person sort of calm down and relax. More than other groups, spouses and partners talked about what they did physically in the car. So some talked about physically reacting in the car, like grabbing the door handle or tensing up to convey nervousness. Others talked about with that same idea of sort of calming and trying to relax the person, like physically rubbing the person's shoulder or putting on music in the car, just trying to bring down the temperature a little bit and diffuse the situation. Parents didn't have a lot of other things that they'd tried with their kids. Um, Multiple parents said that they felt like they almost had to let something bad happen, that it was the only way that their child would learn. And a few of them in particular pointed out that there wasn't anything like substance use that was also involved in these situations. So other ideas they had, like NA or AA, like that wasn't helpful and that didn't apply. Sort of felt like they didn't know what else to do. And again, that they felt like their teenage or young adult child just had to learn the hard way. And if something worse happened, then they would step in more. So maybe you're seeing there in these patterns that emerged across the different groups. Folks were trying a lot of different things. They talked about attempting numerous times, trying humor, trying serious, talking before getting in the car, debriefing afterwards, using different approaches. But overall, they talked about not making a lot of progress. In trying to understand the barriers that they faced, Folks talked about being afraid of an argument and risking a relationship, particularly in friendship, sort of alienating that person, but also in other relationships. Folks didn't want to put the relationship at risk. People also talked about being concerned that they would make it worse. Oftentimes the driver is upset or angry in that situation, and they didn't know what to do that would help and not potentially make it worse. Similarly, they talked about not wanting to say the wrong thing in the moment. They weren't sure what to do or say. And overall, the pattern was really tiresome for both parties. We didn't get a lot of optimism from the bystanders that we interviewed. Bystanders talked about not being worth it because they just brush it off. I've tried talking to them, but it doesn't seem to make a difference. And in the bystanders' reports of the drivers, we also sensed some sort of tiresomeness, right? Like one bystander talked about how the driver actually drives faster just to get them out of the car, which sort of is contrary to what we might be looking for in terms of reducing aggressive driving. So they talked about how both they didn't have a lot of optimism and this sense that the driver was also sort of sick of talking about it and they weren't making a lot of progress. We asked bystanders what would help, what would make it more likely for you to intervene, or what would make it easier. And friends talked about how if people's safety were truly on the line, like if there was an imminent risk of harm to someone, that would make it easier for them to intervene. Friends also talked about, having a tool like a show or a video or a book to help with the driving behavior or something else that could really demonstrate some of the consequences that were possible. Spouses and partners, a few of them talked about how if the person were really intoxicated, they wouldn't let them drive. And multiple said, if the situation were to get really extreme. So there was this sense that they were waiting for something bad to happen. Parents had the same sort of response to this question. They talked about if they were very concerned for her life, they would use more extreme measures. A couple talked about then they would take away the car or then they would restrict access to driving, but only if it got worse. Parents also talked about knowing what to say, right? Having the right words and knowing how to approach it, and also knowing how to respond to some defensiveness or when their teen or young adult child wasn't receptive to their messages. We asked bystanders how confident they were in their ability to intervene, and most were somewhat confident. They shared that their confidence would increase if they knew how to approach it, if they had the right words, as well as effective communication strategies. They also reported that knowing about others advocating for safer driving would be helpful, sort of like a team approach. And then they could make reference to those other people in the driver's life that are also concerned about their driving. We wondered about the feelings of responsibility and influence among the bystanders. Folks felt a lot of responsibility when we asked them about their responsibility for the person driving more safely. They said they felt huge amounts of responsibility. The responses were like, I'm the only one, I'm their best friend. If it's not me, it won't be anyone else. Spouses, partners, and parents also felt a lot of responsibility in this scenario, but they had varying perceptions of being influential. Some felt like they were moderately influential. Some thought that they were briefly influential, right? Like it makes a difference, but only for a very short time, and then sort of they revert back to their previous behavior. And some didn't really know, like they weren't feeling very influential. So they were feeling responsibility, but not influence. And that can put us in sort of this ambivalent place that is challenged to move forward to intervene. So from those interviews and our insights from them in terms of what people needed, what they were already doing, what would be helpful for them, we moved on to develop and then test an intervention to support bystanders. So we wanted, again, these bystanders to be able to encourage safer and less aggressive driving behaviors. And we were looking to develop strategies for friends, spouses and partners, and parents of teen or young adult drivers. And we understood and knew, again, from the insights of the interviews, that the strategies would need to encourage and motivate bystanders about the influence they do have, as well as educate bystanders about risk and dangerousness and sort of enhance this motivation to intervene early. We heard from a lot of different folks that if it got worse, if it got really bad, then they would intervene. And one of our goals was to encourage folks that they did not need to wait for that, right? That they could intervene earlier, and it might be easier then as well. We heard loud and clear that folks needed language, they needed to know what to say, and they needed some help enhancing communication skills, as well as reducing or managing reactions that folks might have. And we wanted to build the driver's motivation and support their behavior change. So we developed strategies for testing. These were parallel strategies for our 3 different groups. So they were customized such that the individual was labeled, right, for your friend, for your spouse, or your partner, for your child. And there was some specific examples, but they were parallel in structure. And we utilized the trans-theoretical model for behavior change. So this idea of increasing awareness and encouraging movement across stages of readiness towards behavior change. We included communication skills in our strategies, and the strategies had 3 main steps. The first was to express concern. So it really helped the bystander express concern about the risky driving behavior. The next was to connect to values. Things like, I know you care about keeping our family safe, driving more calmly can help make sure we all get home, giving them some language about how to connect to values with their person. And then we gave them 3 choices for the third step. They could choose between correcting misperceptions, responding differently in the moment, or preventing additional harm. Once we had developed this parallel strategies for the 3 groups, we recruited another sample of bystanders. So these were adults in the United States who, again, were concerned about the driving behavior of a close friend or family member. They had to report that the driver engaged in at least 2 aggressive driving behaviors in the past 30 days. And we gave them 2 surveys 2 weeks apart. So in survey 1, we had a baseline survey where we asked them questions about the driver's behavior, their relationship, if they tried talking to them before. Then we gave them the intervention. It was pretty brief. Again, it was those 3 steps, and they got to choose their third step. And then after that, we asked them some post questions about the intervention and let them know that we'd be contacting them again in a couple of weeks with a few more questions. Then 2 weeks later, we administered a follow-up survey to those same folks. We partnered with Qualtrics to obtain the survey sample, and we conducted the data collection in Qualtrics. We had 102 participants. About 40% were friends, about 40% were spouses or partners, and about 15% were parents. These were the bystanders of people who were driving aggressively. They were split 50-50 between men and women, and they were diverse in other demographics. They were talking about drivers who were about 60% men and 40% women, and most were over the age of 18. All of the participants were over the age of 18, and most of the drivers were as well. A few of the parents were talking about teen drivers under the age of 18. We asked the bystanders at baseline survey to describe their perception of the driver's awareness and willingness to change, again, aligning with the trans-theoretical model for behavior change. And the bystanders said that most drivers were aware that they were concerned about the driving, and that the drivers were resistant to change. This is not unexpected. That's what we thought would probably be the case. So that was most drivers, and then 10% were aware, and the bystanders thought that they were not resistant to behavior change. At baseline, most participants said that they had talked to their person about their driving sometime in the last month, and nearly all had talked with their person at some point in the past. That makes sense, right? And again, it aligns with folks, with the drivers knowing that the person is concerned about their driving behavior. At follow-up 2 weeks later, again, most 70% reported that they had talked with their person about their driving, and an additional 19 had tried to initiate a conversation. So 90% talked or tried to talk with their person in the 2 weeks in between survey 1 and survey 2, using the information that had been given to them at the intervention. Step 3 of the intervention had included a choice for the bystander participant. Again, those options were to correct misperceptions, to respond differently, or to prevent harm. Most of the participants, a little more than half, chose correct misperceptions. And then about a quarter chose to respond differently, and another quarter chose to prevent harm. At follow-up, we asked them if they had used each of the steps. We asked them specific questions about whether they had done the things associated with the steps. And folks were most likely to have reported using, responding differently, and correcting misperceptions. So folks that chose correct misperceptions, 83% of them reported having used that strategy. And folks that chose responding differently, 96% of those people said that they had used that strategy. Fewer people had chosen prevent harm, and it was used less often. So folks had more trouble utilizing that strategy when they chose it compared to the other two, which is an important finding that we'll come back to in a few minutes. When we looked from baseline to follow-up, participants had reductions in concern about their person's driving. So in those 2 weeks, most of them talked with their person and they were less concerned about their person's driving at follow-up. They also reported improvements in confidence that they could communicate effectively with their person about their driving, and they were more confident that they could influence their person's driving. So those were promising improvements in terms of their ability to communicate with that individual about driving. We also asked at follow-up about how those conversations went. And most reported that drivers were moderately open-minded to having conversations and that they were engaged in the conversations. Overall, fairly positive response at follow-up. Again, at 2 weeks after, so follow-up 2 weeks later, half of participants reported that their person was driving aggressively less often. And an additional 39% said it was about the same. Few participants reported, that their driving had gotten worse or that they were engaging in aggressive driving more often. Half of participants also reported improvements in driving safety. So 37% said that they were driving somewhat better, an additional 15% said that they were driving a lot better, 42% said it was about the same, and few participants reported that it was worse. We asked about likelihood of additional conversations and future changes. Most participants believed that their driver would change in the future to be more safe. And the majority of participants, 80%, said that they were at least somewhat likely to talk to their person again about their driving in the future. We asked participants if the intervention information was helpful and if they were able to use it. Folks said that it was helpful and that they were at least somewhat able to apply the information that they learned. Most said that they did not need any additional information. So from those findings of the intervention of testing with those participants, we developed that conversation guide, the one that you have the bit.ly link to earlier in this presentation. And that conversation guide is developed for the bystander, and it uses these 3 similar steps. They're a little bit different than what we tested, but very similar. So the first step was to express concern and connect to values. The second step is to compare to other settings. So to compare that driving behavior to what that would look like in a different setting. And then the bystander can choose between correcting misperceptions or responding differently. You'll notice here that we dropped that preventing harm option, again, because fewer participants chose it, and those who did choose it were not able to use it as well as they could use the other options. And so we decided to simplify and have those 2 options in step 3. We also include communication tips, this encouragement to intervene and to do so early. And in an effort to make one conversation guide that can work for the different kinds of populations, we have basic language for friends or spouses and partners, sort of a peer group. And then we have call-out boxes with example language that's appropriate for parents to deliver to teens and young adult drivers. And so the link is here again. This conversation guide, again, is intended for the bystander, so that end user to really help that person have a conversation. As I mentioned, we avoid using the word aggressive driving in the title and in most of the content. There is an introductory blurb about aggressive driving, but you might find that this conversation guide could also be used for other risky driving behaviors, though it was intended primarily to address aggressive driving. We also built a toolkit that is intended to help promote the conversation guide, so to disseminate it to those audiences. Um, and we were thinking broadly about toolkit users, and we would encourage you to do so as well. We were thinking about transportation leaders and stakeholders for sure, as well as public health folks, community leaders, schools perhaps. Coalition leaders is something that we thought about a lot. What would a person in that kind of role need in order to disseminate the conversation guide to their community? So the toolkit includes talking points, a worksheet to help identify additional partners. And so you might be able to use that to brainstorm additional partners that maybe haven't been engaged in building traffic safety culture previously. And then it also includes outreach materials like a poster to hang or a table tent for an event, some postcards, social media messaging and examples that can be used as well. So I wanted to pause here and just see if there are any questions, especially about methodology or results of the bystander intervention before we move on to messaging, because I'm going to shift gears to that other component in a second. So Kelly, any burning questions about bystander intervention?
No questions that have come in on the chat.
Okay.
Folks also have
Great.
the ability to raise their hand if they're having any issue with the chat, and we can respond directly to you. But as of right now, no questions.
Okay. Thanks, Kelly. Yeah, so if you have any questions about that or anything else, feel free to put them in the chat. Otherwise, we will keep moving along. So the other part, oh, I just saw it. Yeah, perfect. I see Taylor. So Kelly, if you can unmute maybe.
Yep.
Thank you.
I just have a message that says public chat with everyone is turned off, so I don't have an opportunity to put questions in the chat. Thanks.
Interesting. Okay, if you can just double check, you might be able to choose from the drop down and choose host, co-host, or panelists. So you might not be able to chat with everybody, but you should be able to direct to me and Kelly.
Okay, great. Thank you very much.
Thank you.
Thanks, Taylor.
And we'll have time at the end to come back to questions. So if you're still pondering your question or comment, feel free. Okay, so then as I said earlier on, the second purpose of this project was to develop and test messages. So in the previous phase, based on the survey with aggressive drivers, we had suggested that traffic safety stakeholders might use messages that grow pro-social driving or use strategies to support cognitive reappraisal and adaptive responses. And so our goal here was to develop and test some sample messages that would do that. So based on those previous results, we did develop messages in these three themes. So pro-social driving messages were intended to promote courteous and considerate driving. Cognitive reappraisal messages were intended to reframe other drivers' behaviors, to reduce our negative assumptions about other drivers with whom we share the roadway. You know, maybe they didn't cut you off because they're a jerk, maybe they cut you off because they didn't see you and they made an innocent mistake. So it's thinking about other drivers' behaviors differently. A lot of sort of giving the benefit of the doubt. And then adaptive responses are coping strategies and alternative reactions that we can use to manage our own responses. So things like taking a deep breath, you know, instead of laying on the horn, changing the radio station. Like, what can I do within my own influence to help myself respond differently? And then again, we were looking to apply the trans theoretical model. And so this idea of stages of change, we were really focused on pre-contemplation and contemplation. So for pre-contemplation, we wanted to increase awareness and concern about driving. This might be among folks who've never thought about their aggressive driving as a problem. And for contemplation, we wanted to encourage people to motivate towards some behavior change. In both cases, we avoided giving any kind of direct instruction, but instead encouraged self-reflection and people increasing their own motivation to change. As part of message development, we reviewed current and previous aggressive driving messages used by the states engaged in the traffic safety culture transportation pooled fund. We wanted to know what's been used before, and it helped us understand what was feasible. We also asked our pooled fund members to tell us what channels they use most often, again, because we wanted to develop messages that could perhaps be used very readily with the same avenues that they commonly use. We developed two-part messages. Each message had a longer component. This might be shared on social media or on the radio, that sort of thing. And then there was a short billboard style message as well. And you'll see a few examples in a few minutes. And so again, the messages were developed across the three themes that we've discussed and these two stages of pre-contemplation and contemplation. After we developed the messages, we endeavored to test them with a sample of US drivers who reported driving at least weekly and endorsed two or more aggressive driving behaviors over the past month. So the inclusion criteria is very similar to that as for the bystanders. We wanted folks who were yes, at least doing two of these aggressive driving behaviors, so it wasn't necessarily just a one-off and that they had reported doing so fairly recently. Working with VeriCite to obtain this sample, we obtained a sample of 864 participants, about half men and half women. 1% reported that they were non-binary, and they were diverse in other demographics, including geographic location, how rural their area was, their state, socioeconomic status, race and ethnicity. So some diversity across those demographics. Our participants were randomized to condition, and each of them were shown 4 messages. Some folks were in a pre-contemplation only condition, and so they were shown only pre-contemplation messages. and they were shown 2 messages in 2 of the 3 themes, or if they were in a contemplation only condition, they were shown only contemplation messages. And then we had some folks that were in a paired condition where we paired a pre-contemplation message with a contemplation message because we were interested in understanding if it was more effective to give them this pre-contemplation message to increase awareness, followed by a contemplation message to motivate change, if that was more effective than just pre-contemplation or just contemplation. So we had these different conditions to allow us to understand differences based on theme and based on stage. Folks were shown the messages and asked questions immediately about each message in survey 1. They saw the messages 2 times during that survey 1. Then 1 week later, we followed up to ask them more questions in survey 2. Overall, the messages were highly rated. Folks said immediately at the time that they saw the message, they gave positive ratings of the messages. They reported that the messages made them think about their driving and motivated them to drive more safely. They also reported that same thinking about driving and motivating at follow-up. Across the 3 different themes, pro-social messages were rated the highest. And here are 2 examples of these messages. So they were presented to folks in writing, again with the idea that it could be an audio message, but in the survey they were presented in writing with the longer message and then also that potential variable message board message as well. The message on the left is a pre-contemplation message. The message on the right is a contemplation message. These are both pro-social messages and they were rated the highest across the different messages. The single highest rated message was this adaptive response contemplation message. Again, all of the messages were rated highly, and this was the highest rated message. There were no differences by theme or stage. There wasn't a particular theme that was rated low or a stage that was rated better than the other stages. 1 week later, recall by message ranged from about a third to about 55%. And again, here, there were also no differences based on message theme or stage. Folks had only seen the messages that they were presented 2 times during survey 1, but it was just during that one occasion that they had seen them. So it's not surprising that the recall isn't much higher. One of our recommendations is to increase dosage of messages. And at the 1 week follow-up, again, folks said that the messages made them think about their driving, motivated them to drive more safely, made them think about the safety or well-being of other people on the road, which is important for addressing aggressive driving, made them think about what they can control, and made them think about reacting differently to other people on the road. So we thought that this was a promising set of insights for just 1 week later after having seen the messages just at that one previous occasion. But again, there were no differences by theme or stage. So pro-social wasn't better in this way than adaptive response or cognitive reappraisal, and there was no difference between pre-contemplation alone, contemplation alone, or those conditions where we had paired them together. Compared to survey 1 week later at survey 2, participants were more concerned about their own driving and were considering changing their driving habits. That's here. So from survey 1 to survey 2, their thinking about change, their readiness to change significantly improved. They also perceived other drivers as better drivers. They perceived their driving as good and safer compared to survey 1. And that gives us an important insight that we might be able to adjust these hostile attributions of other drivers that are common in aggressive driving. So from this, we developed a resource with some recommendations to develop messages in these three themes. Again, these themes were based on findings from previous survey work in our phase 1 work, and we didn't see differences across themes in how effective they were. So pro-social driving messages were the most well-liked, but overall folks liked all of them, and they were effective in having them think about their own driving differently and the driving of other people. So we would suggest considering messages about pro-social driving, cognitive reappraisal, or adaptive responses, or mixing them up a little bit. We would also suggest considering pre-contemplation and or contemplation messages, right? Because we don't know the stage of change of the person receiving the message. There's no way to know if the person who's hearing an audio ad or seeing a social media message is in pre-contemplation or contemplation. There's no way to pair the message to their readiness. But across our sample, there were no differences in stage, but we would suggest considering those types of messages, the ones that plant seeds, that encourage people to reflect about their driving and think about changing, without messages that directly instruct people to drive differently. This guidance is available as well in this message guidance resource. The bit.ly link is there and will be in the chat. There's a few pages of recommendations, and then there's sample messages from each of the three themes. Thanks, Kelly. So as we summarize here, there were 3 different resources that you've received today. You have those links, the driving conversation guide, that's the main resource. That's for bystanders. We want to get it in the hands of bystanders, and we're hoping that you can help us do that. The toolkit supports your dissemination of the driving conversation guide, yours or someone else's. So the toolkit is designed to really help folks think about partners and to give some sample materials that can be disseminated. On the driving conversation guide on the last page, you'll see a spot where you can add your organization and your logo. If you're interested in co-branding it with us, we would welcome the opportunity to have that happen. And you can feel free to host the conversation guide on your own website as well to make it local and to make it relevant. If you choose to do that, that would be great. If you're not able to do that, you're welcome to use this bit.ly link to disseminate and to try to get it out to your audiences. Then also there's the link for the message guidance. In addition to those resources, there's this PowerPoint presentation. It is being recorded and will be on the center's YouTube page. It'll also be available on the traffic safety culture research pooled fund page at MDT. Additionally, the full final report, if you'd like more information about methodology, there's more graphs and tables and all of those findings in detail there. And so that'll be available. It's not there quite yet, but it should be up sometime next week. You can find the MDT traffic safety culture page by Googling that phrase. The link there is there. It was also provided early in this conversation when we talked about the previous work. So you'd also find the phase 1 work, final report, and resource there as well. Happily, we do have a few minutes for some questions. So if anyone has any, feel free to drop them in the chat or raise your hand if you want to come off of mute.
And I believe I changed the setting, so you should be able to just pop it right in the chat box for everyone. I know some folks are having trouble with the direct one, so I think anyone can go ahead and just add your question, but we will also review the direct chats and make sure there aren't any outstanding questions. So yes, the presentation will be made available. I will be following up with folks after the webinar to ensure that you receive all the links, and also the final report and resources, as Bridget stated, will be on that project page. So I will make sure everyone gets those following.
Great. Thank you, Kelly.
Yeah. I am not seeing questions, just comments about folks thanking
Sure.
for the resource.
One other suggestion and ask, I guess, of this group. So if you need any support or help, technical assistance to implement these resources, feel free to reach out. We can provide that in a limited degree, but we'd be happy to understand what else you need or what else would be helpful. So if you encounter any challenges, don't hesitate to ask. And then if you are able to use resources, these, or if you've used other resources of the pooled fund, we'd love to hear about it. So please do reach out if you have questions, need support, or if you're able to use those resources. Just to circle back, it would really help us if we understand how they're being used in communities. On this final slide, there's contact information for the center as well as my email address. If you have any other questions that pop up, feel free to reach out. You can visit our website for more information about upcoming events, including training that we're offering in the fall. And you can find our YouTube page, LinkedIn, and Facebook as well, where we occasionally post new updates. We'll hang out for a few more minutes if there are any other questions. We'd be happy to discuss. Otherwise, thank you again so much for attending and appreciate your time here.